Hello, everyone, and welcome to this audio podcast. This audio podcast is an audio podcast in around the Erythropoiesis edition. This is an audio podcast as part of the Hurricane Plexar. The An audio podcast as part of the Labonix Vendip. An audio podcast as part of a storm robotics production. In this audio podcast, there'll be a synopsis. There'll be a synopsis in around sort of another audio podcast series, and where this audio podcast series looks at works that works that sort of started out initiated sort of almost 20 years ago, and well, actually, in April 2023 would have been exactly 20 years ago, and so this audio podcast will look at works in around we'll look at works at the importance of reduced nephrotoxic medication for those recipients, paediatrics and young people, for example, who have been, for example, who have solid organ transplants. So I'm gonna, as part of this audio podcast, a little bit in around a little bit of a sort of a synopsis in around this. So nephrology or renal medicine, renal medicine as a specialty is established as a very as generally an advanced application in the world of clinical medicine, and also clinical medicine, and also clinical aspects of clinical science. And thus there and though there is much research covered in the field, in the field or in the specialty, it has not completely been conserved. Nephrologists have much concern, or have concerns, over the sort of medications prescribed and administered in pediatrics and young people, as they can have varying side effects. The aim of this works was to establish whether renal grafts or allografts in pediatrics or young people are able to survive, or have a prognosis for 10 to 20 years post transplantation with the aid of immunosuppression, where the added aspect to introduce sort of anti-rejection therapy or immunosuppression therapy with reduced nephrotoxicity. Nephrotoxicity, by definition, is where sort of historically in the field, in around the specialty, there have been varying sort of analogs and monologues of treatment or therapies in line to immunosuppression, and where for example, first and second generation treatments can and have sort of those effects that can prompt or propagate sort of damage to sort of additional damage by their side effects to the functional components, i.e., for example, nephrons or podocytes, in context of renal pathophysiology or renal anatomy. So investigation in pediatric nephrology, or the specialty for this works, would was one of the one was one sorry a sort of a literature investigation in around pediatric nephrology for this works was one of the sort of initial, and perhaps at the time one of the best approaches to identify a sort of the sort of the sort of the sort of the sort of clinical practices and advances in context of pharmaceutics and pharmacology, for example, that had been made in the early in sort of the pre sort of before the sort of before the new millennium era. So this includes obtaining this works included obtaining experimental data and research aligned to post-transplantation after identifiable or appropriate major histocompatibility complex donor from donor to recipient. And so by obtaining information related to important details such as pharmacokinetics, pharmacodynamics, and toxicological data, established data on in around immunosuppression and other medication applied in pediatric nephrology, and other sort of medications applied in around pediatrics and pediatric nephrology. Where this works look to sort of delve in and determine. At the same time, it had been essential to sort of recognize drug regimens in pediatrics and indefinitely toxicological effects that demonstrate nephrotoxic concern. The application of pharmacology was used for also additionally looking and delving into toxicological effects of specific regimens. The procedure and data collected can appoint looked wherein the data investigators and researchers look to sort of collect data in around sort of the pharmacodynamics, for example, and also where investigators and researchers in context of the literature could appoint therapy in pediatric recipients with reduced where treatment regimens would have a reduced side effects. So the main the main sort of the sort of parts of the main works also include looking at again sort of statistical data based on evidence involving sort of best renal transplant for pediatrics and post-transplantation drug regimens and immunosuppression therapy and how they affect the recipient. And there is much toxicity in medication. There can be a sort of toxicity in certain medications regimens, and the basis of this, or part of this works look to identify the sort of toxicity profile. And by this approach, anti-rejection therapy in aligned to the literature can thus be sort of can thus be used as an approach to treat patients or recipients in the pediatric and young population suffering with kidney disease. And so, from carrying some of the crucial aspects in around this project and around this works, the overall approach will also be to investigate sort of drug regimens and to understand its importance in children that suffer with renal failure and various forms of renal failure, and see if and again to identify anti-rejection therapy that can be produced in context of pharmaceutics with reduced side effects. At the same time, the aims of the project have been highlighted, have been sort of alluded, but at the same time, to give an understanding of immunosuppression therapy, the importance of BEST, or what's been referred as a sort of BEST Major Histocompatibility Complex, or MHC, with the Human Leukocyte Antigen, or HLA presentation amongst pediatric renal sufferers, is and was also part of the sort of a consensus in around reviewing in around literature before the new millennia as well. It was essential to also recognize that reduced nephrotoxic immunosuppression therapy should become available for pediatrics and young people suffering with different forms of renal disease or kidney disease, and those suffering once transplanted, or where a recipient or a renal sufferer, a pediatric or young person who's suffering thus then once having received a solid organ transplant, the literature and the sort of basis in around this works additionally looks to sort of propagate looks to propagate and sort of inform how renal allografts can have sort of a prolonged survival or prognoses, for example, between 10 and 20 years post transplantation, or more sort of longitudinally, and so in this is part of this works as well. There is one of the main bases or main aspects is to investigate specifically in around the literature around pediatrics and pediatric nephrology, but at the same time in context of clinical practice that align to scientific practices and thus where scientific practices look at sort of aspects of sort of apart from serology and tissue typing, sort of the general aspects in around clinical science, where this research or this works or this series will also delve into aspects aligned to the laboratory medicine as well. Ultimately, this series will look at, apart from apart from that, which has been aforementioned, this series will also have a look at sort of some of the literature in sort of more sort of recent in sort of more recent or prospectively, and again, as in previous audio podcast series, there will be some literature where literature or citations where listeners and viewers can check out works relating or regarding to this audio podcast series. So thank you for tuning in. This has been a synopsis in around the Erythropoiesis edition, an audio podcast as part of another radio, sort of another radio edition, and also an audio podcast as part of the hurricane Plexar, an audio podcast as part of the Labonix Vendip. Thank you for tuning in.